These days, I'm particularly focused on research on prostate cancer. I'm interested in looking into health disparities and looking into better understanding the how can we address, how can we promote health equity to address disparities, but in prostate cancer. And also, how can we make sure that all of these wonderful progresses that we have, how can we make sure that everyone, everywhere, and at all time can benefit from this progress? I also interested in research to discover new tools to earlier and better diagnosis, new tools for risk stratification and prognosis, but also new treatment. We definitely need more treatment options to prolong the life of our patients, and also more tolerated treatment to minimize side effects on them. I believe that participating in clinical trial is the best way to help us move forward and to promote like discovery, innovation, and do better in terms of treating our patients. In fact, there is no way we can make progress without having volunteers into these clinical trials. And what I would like to remind my patients is that participating in clinical trials does not mean necessarily that the participant will directly benefit from those trials, but at least they will allow us to gather more knowledge, more information, so that we can treat better other patients. And these other patients may be their family, their friends, their loved one, and the community in general. So the best way for patients to figure out if they are eligible is to talk to their doctor or talk to the team in charge of the clinical trial to figure out if they meet the criteria, if they're eligible for these studies. Often they may need to do additional testing to make sure that those patients meet the requirement of those studies. Participating in clinical trial, I believe, is a way for patients sometimes to have access to even better treatment, definitely. However, I would say as well that participants should be aware that participating does not necessarily mean that they will directly benefit from those treatments. However, we would always gather new information to help us treat better other patients and move our knowledge on how to do better.